Face masks and gloves, sanitizing spray and laser thermometers. Amid the coronavirus pandemic, such medical supplies are in high demand. But in Mexico, they aren't always available. Yet when it comes to their manufacture and export, Mexico is booming. Medical supply factories like this one in Ciudad Juarez, just steps from the US border, have remained open throughout the COVID-19 pandemic. But the vast majority of products made here don't remain in the country. They're destined for hospitals across the United States during a time when Mexico is facing huge shortages. Here at RexMed, its masks, gloves and portable respirators head north of the border as soon as they're ready, an irritation for the locals.
The factory is owned by an American company, but the products are made by Mexican hands, so something has to remain here.
Fears of the contagion are here too, as these essential workers remain on the job, often for longer hours than prior to the pandemic. However, Carlos Murguia, the director of RexMed, argues that his factory is the safest place to be.
Nuestro ambiente de trabajo siempre ha tenido protocolos muy exigentes.
Our sanitary precautions have always been very demanding, precisely for the types of products we manufacture. We work in highly graded, sterile rooms, and everyone has to wear full protective clothing. It's normal for us to be working under these conditions. For me, it's safer to be in a sterile room here than in my own house.
Indeed, business is booming, and Carlos says his home country is benefiting as a result.
Demand has grown so much that we are increasing our factory size and production capacity, and that is allowing us to leave some of our products in Mexico, which we never did before the pandemic, while still meeting our orders from the US.
But many Mexicans, pandemic or not, say the focus here has always been on foreign needs.
It's always been this way. We have always worked for other countries instead of working for ourselves. So while the United States has been in lockdown, taking care of the public, we have had to work. It's always been this way in Mexico.
As the global economic model favours sending medical supplies where they'll get the best prices, ironically, the communities making them may be among those most at risk. Alistair Baverstock, CGTN, Ciudad Juarez, Mexico.